Jacqueline Martinez Garcel is NYSHealth Senior Program Director with a central role that includes developing the Foundation's program areas. Today she's going to talk more about the priority area of integrating care for mental health and substance use. Jacqueline, when the Foundation first began in 2006, it chose integrating care for mental health and substance use as one of its priority areas. Why?
Well, first of all, there was a significant need that needed to be addressed, both from the human perspective and the financial toll that this population has in the state of New York. Over 50% of the people who have a mental health condition also have a substance use problem. Same is true of somebody who suffers from substance use. They also have a mental health condition. At least half of them do. So we knew there was a need in New York State that needed to be addressed. We also know that there are two separate systems that have been created that are siloed, and it creates a revolving door for people that are seeking care for both conditions at the same time. Second of all, there were opportunities for us at the time to take this on as an issue. The Office of Mental Health and the Office of Alcohol and Substance Abuse actually took this on as an area that they also focused on. And there were about 12 sites throughout New York that were outpatient sites that delivered care for this population. And there was an opportunity for us to take evidence-based practices and spread them throughout New York. Third of all, there was a niche for us to have a tangible impact in this field. Because there were evidence-based practices, because there was a set amount of outpatient sites throughout New York, there was an opportunity for the Foundation to take these evidence-based practices and spread them throughout the state.
Can you give us an overview of the Foundation's efforts over the past 5 years in this area?
Sure. We decided to just establish a center of excellence that would focus on integrating care throughout the outpatient sites in New York. This Center of Excellence was led by NDRI, who then worked with providers across the state to help them implement integrated care for diagnosing, treating, and identifying both conditions at the same time.
And did the Foundation achieve the goals it set out to achieve?
Yes, it did. We set out to work with at least half of the sites throughout the state of New York. And to date, the Center of Excellence has actually worked with over 500 of these sites. And they have helped providers integrate both the mission of their organizations, the treatments that are necessary to treat people with both conditions.
What has been the biggest takeaway for you from this initiative?
Well, I think the biggest takeaway is that this level of change, this level of transformative change is possible, but it does require public and private leadership. If the Office of Mental Health and the Office of Alcohol and Substance Abuse would have not been part of this, our efforts would have been limited. And because of this joint effort, hundreds of thousands of New Yorkers now have better integrated care.
Thank you.